Hello, everyone. I'm Özge Tunçalp, a medical doctor and global health researcher with a background in sexual and reproductive health. After many years working at the intersection of science and policy at WHO, I recently joined the Institute of Tropical Medicine in Antwerp as executive director. This is my first time addressing the Because Health General Assembly. And while I regret not being there with you in person, I'm very glad to be able to share a few reflections virtually. In these challenging times, we are reminded that health is never just technical. It is political, social, and profoundly personal. Across many countries, democratic space is shrinking. Rights are under threat, including sexual and reproductive rights, a topic so close to my heart. And this erosion ripples far, reaching from the Commission on the Status of Women in New York to the World Health Assembly in Geneva. And yet, in moments of uncertainty, we must double down on what matters. For me, the anchor through conflict, through backlash, through complexity has been science. In my experience, science isn't just a set of findings. It is a form of accountability and a bridge. It allows us to connect across disciplines, across countries, and even across differences. That's why, especially in polarized times, I believe our shared commitment to evidence is not only what unites us, it's what propels us forward. At ITM, we are proud to be a space where science, policy, and solidarity intersect, where values of equity, partnership, and evidence-based action are not negotiable. We are honored to host Because Health, a vibrant network that embodies these values. In times of backlash, such spaces are not a luxury, they are essential. Things are evolving, and official development assistance is evolving as well. But the need for global public investment in common goods, like epidemic preparedness, universal access to essential diagnostics, resilient primary care, has never been clearer. This is not about charity. It is about shared responsibility and mutual benefit. Belgium's policy choice to prioritize health alongside climate and stability sends an important signal. But let's be clear, policy priorities must be matched by financial commitments. We hear from our fellow directors of research and public health institutes in low-income countries who are already facing painful consequences of reduced funding, including cuts to multilateral mechanisms. In that context, local leadership is not aspirational, it's crucial. Our partners around the world are not waiting to be invited to the table. They are shaping their health agendas, leading research, defining solutions. This is something we've seen firsthand at ITM, whether it's co-creating research on sleeping sickness, mpox, or maternal health. The impact of jointly defined research agendas lasts well beyond funding cycles. Let's not miss this moment of change in the global health architecture. Let us, together as Belgian actors in global health, in partnership with institutions across the globe, make strategic choices that honor the progress we've made and protect it for future generations. Because in a world where it's harder to know what to trust, and where global tensions test our sense of solidarity, we must remember, science has the power to unite. In the end, it remains our strongest tool for justice, for progress, and for peace. As director of ITM, this is the commitment I carry forward, together with all of you. And as ITM, we will continue to bring the science and evidence base that you can rely on to make your work on the ground more effective and impact-driven. Thank you.